of hospitals, small healthcare providers, rural access hospitals. This is a very, very important issues, and certainly my public policy involvement came out of the fact that we have a healthcare system today that's built on regulations from 50 years ago, many of them, which is probably step one with healthcare reform, bringing regulations into the 21st century. Mr. Hannon, first question, with we're talking about the President's budget, Medicare and impact, and small providers. Many hospitals, in my experience, and I'm sure you concur, and healthcare agencies rely on charitable contributions for investment in capital expenditures, new equipment, diagnostic equipment, sometimes treatment intervention equipment, and that's driven through charitable contributions. And any thoughts on how the President's proposal to eliminate the charitable tax deduction for some taxpayers may impact that?
Thank you for the question. While I haven't studied that with the American Hospital Association, I'm very concerned about that, certainly. Having come out of Pennsylvania myself prior to going to North Carolina, a great deal of how we survived, how we grew, how we provided technology was through philanthropy. Even today, as we look in North Carolina, for example, with the economic times that we've already been told by some of those philanthropic organizations that we're likely to have less opportunity and a greater competition for the few dollars that are going to be available to us. Their contributions are down in those agencies, and therefore their ability to hand that money to hospitals is also down. We used to rely on it, and I'm sure many of my colleagues across the country would agree that we can sustain our day-to-day operations usually from the revenue that we get from patient care, the ability to expand, the ability to bring new technology, the ability to replace our aging plants is really done by those contributions.
Okay, thank you. I want to take that tax proposal within the budget, one next step to kind of open this up to all those who are representing the physician providers, just to see, what do you see as the impact on small healthcare providers, specifically those physicians whose practices may be organized as LLCs or S corporations with the President's proposed tax increase rate? For those that are in that $200,000 or $250,000 and higher.
I confess I don't know enough to answer your question about the tax code and so forth. I couldn't give you a meaningful answer.
Any thoughts? I certainly encourage you to go back and take a look at that in terms of those physicians that you have that are organized in those ways, that they are they're going to be impacted pretty significantly, perhaps by that. Next question, actually, back to Mr. Hannon. I know one of the things in rural, and it's good to hear you came from Pennsylvania. Sorry you left. In rural Pennsylvania, one of the issues that I hear all the time, and I experienced myself, had to do with the Medicare wage index and how that drives reimbursements. And in terms of the differences, how does the wage index, in your opinion, the wage index payment system impact rural providers versus urban providers? Any opinion on that?
I do have an opinion on that. I have found that over the years, and most of my career has been in rural healthcare, that as the rural communities, especially those adjacent to more metropolitan areas, are competing for that labor force, we're at a significant disadvantage. We can't compete with the wages of our urban counterparts. It is harder for us. We all compete for labor. There is a shortage of labor. There's no question about that, whether it be X-ray technicians or nurses or physicians. As we recruit, it is much harder for us with that wage index formula.
Okay, great. Just a short time left, but throw one question out that I don't think has been addressed. A looming crisis in healthcare, as I see and experience, is the lack of qualified physicians, nursing, and allied health as a result of the baby boomer retirements, especially in rural America. And any thoughts what the impact will this be, not just fiscally on our healthcare, but certainly from a workforce perspective on those that you may represent?
I'll be happy to start. And we have 400 320 employees, 311 FTEs, 70 of my employees, 70 of the 400 are over the age of 60 this year. We will have a significant problem trying to recruit technicians, especially to that area. As we look at recruitment of physicians to our community, we are finding that the group of physicians that we're able to recruit to our community are actually those who are nearing retirement. Those coming out of residency are not interested in coming to rural parts of the country.
Thank you very much. There's no question, general surgical workforce is aging, as they all are. 20 years ago, 39% of general surgeons were in the 50 to 62 year of age group. Now it's 50%. Now, don't get me wrong, I think that's a very blessed age group to be in. Frankly, surgeons and physicians are probably at their prime, but they are looking for that. We are finding that folks are retiring earlier. However, this recent economic change may change that. I think one of the key things is the assistance with graduate medical education. I had a young partner who moved to the suburbs. He had $150,000 of medical school loans to pay back, and that's about what a house would cost when you're starting out. When I graduated from medical school in 75, that's 1975.
If we have an opportunity, maybe with other members, you will have an opportunity to expand.
Okay. Thank you very much.
But time is expired.